Ady puts a human face on how people can still be very contributing part of our community, and he makes a difference. So Ady lets others know they too can make a difference. And I'm just so honored to know him and work with him, I can't tell you.
It's always so great to see you, Congresswoman. I'm grateful for this time to be with you and talk.
It's great to see you, and you're looking good, so thanks for asking me to do this, and I'm glad to be with you.
For 4 years, while your husband was sick, you and professional caregivers tended to him at home. Can you please tell me what was that experience like?
The day after John retired from the Congress, I took him to the doctor, and they immediately admitted him to the hospital. And the doctor that day said, he finished his life work. You need to be prepared that he could die this weekend. Somehow, Joe Biden, who was John's friend for decades, heard, and he and Jill came to the hospital. And Joe said, buddy, you got a lot to live for. And they helped me get through that very scary time. But that began my journey. And we were very lucky at the beginning in that he did recover, but he thought he'd spend his retirement out fishing and hunting and being with all of his buddies, and he didn't have that kind of freedom. So I had to find somebody. If I had to be in Washington, he couldn't go back and forth like I had. There are too many caregivers, quite frankly, that are working their hearts and souls out, and they're not being paid even minimum wage at $15 an hour. They have no benefits. We need to treat caregivers with dignity and respect and understand their value to our society. The person that stayed with John Dingell when I couldn't be there at his side was the most important thing in the world to me. So long-term care became a passion of mine as I lived with my husband and saw the challenges.
That is a heartwarming story about how Joe Biden showed up for your husband and you in those difficult days. I have an excellent team of 7 caregivers whose work allows me to live my beautiful life at home with my family. I've been able to keep my team on for a long time because my insurance company agreed to reimburse me so I can pay them above market wages. What are the working conditions like for caregivers in Michigan? And what do our caregivers need?
Most people cannot afford, without some kind of help, to be able to pay that. And there are way too many caregivers in Michigan. Some is being done by family members because they simply can't afford it. So in particular, women leaving the workforce and having to take on the role of being the caregiver for a senior person or a person of disability. And second, there are many caregivers, and this is a real public health issue too, who are working 2, 3, 4 jobs. I had someone that would fill in for hours. She was working at 4 or 5 other places. And when you get into a public health crisis like COVID, they're coming in and out of different settings, potentially contaminating or carrying germs into another place. We need to pay people a decent wage. We need to give them benefits. We need to show people the value that you and I both know it is of a caregiver, and also make sure we're not burning out our caregivers.
President Biden has proposed a $400 billion investment in home and community-based health services. I know you support this commitment, but Republicans, and even some in the Democratic Party, are not as dedicated to funding critical home and community-based care. Please tell me about the current obstacles that we face in passing the Better Care, Better Jobs Act to expand HCBS.
At the end of June, Senator Bob Casey and I introduced the actual legislation that would enact this into law. And I've talked to many Republicans, and they know that we've got a long-term care problem in this country. This bill, first of all, would allow people to stay in their own homes and in a community setting that they've been their whole life, that gives them a quality of life. It doesn't isolate them. It lets them live with their family and friends. And currently in this country, Medicaid is the largest payer of long-term care in this country. And for the home-based community care that you and I are talking about right now, There's a waiting list of more than 800,000 people trying to even get onto that list. And Medicaid, which is the largest payer, is geared towards institutions. It's geared to being in these long-term care settings, but that we need to give people the choice. They need to be able to stay in their home if they're able to live independently with some support. Caring for people that we love who are getting a little older isn't a Republican issue. It isn't a Democratic issue. It's an American issue. It's a moral issue that we all have to protect people as they begin to get older and make sure they can live with dignity and respect. And we're the only, again, all the other industrialized nations in this world take care of its seniors. They have programs to do it. And I say it's about time for America to catch up.
That is so beautifully said. You are putting the dignity and humanity of millions of Americans into legislative texts. And we are also honored and grateful. Michigan is famously home to the United Auto Workers, one of the most influential unions in American history. In the 1930s, it catalyzed the creation of American middle class by unionizing the auto industry. Then, during the 1940s, 50s, and 60s, the UAW was a central pillar of the movements for social justice. Since then, decades of right-wing attacks on working people have undermined their ability to come together in unions, and no union has built a political power or invested in progressive movement as successfully as the UAW did. Are you hopeful that we can build a movement like that again?
We take great pride in union roots in Michigan. They fight for the working people. They did create the middle class. And people deserve to make a decent wage, to have benefits, to not have to worry about health care or to have a safe and secure retirement. People don't think about this, but things you take for granted today were negotiated by a union. Unions negotiated a 40-hour work week. If you have health care, that got negotiated because unions got it for their hourly workers and they extended it to the salaried workers. You get holidays and vacations because a union negotiated it. We all benefit from it. And people need to understand that when we come together and we work for each other and we make sure that each of us is respected in the workplace and that we are making a decent wage with decent benefits, we need to not forget the history of this country, or that those unions will continue to benefit everybody in the community.
I can't think of a more powerful note on which to end this discussion. All of us are very grateful to you for your leadership on healthcare justice, and I am honored to be in the struggle with you.
You need to know how much hope, compassion, empathy you give all of us, and you give us the strength and the courage to keep going, because together we're going to get this done. Thank you, Ady. I love you. I respect you. I thank you.